Welcome to this short video entitled, Don't Forget to Breathe. And during this video, we're going to outline a few of the physiological aspects of breathing and why breathing is so important apart from the obvious in terms of our general health, and how we might actually engage proper breathing that can promote health, but also help us manage anxiety and stress in certain contexts. Now, I'm sure many of you are aware of, maybe you're not, and if you're not, I'm going to introduce you to the respiratory sinus arrhythmia. And this is a phenomenon whereby when we inhale, we activate what's called the sympathetic nervous system, which is part of the autonomic nervous system. Some people refer to it as the accelerator component of the autonomic nervous system when we inhale. And when we inhale, our heart rate increases imperceptibly. And you can see here on this graph, you can see we have heart rate in beats per minute in real time. And you can see again, as somebody inhales here, this is a real graph, you can see the beats per minute increasing from 60 to 80 over a very short space of time, for example. So when we inhale, we activate the sympathetic nervous system or the accelerator. Likewise, when we exhale, we activate the parasympathetic nervous system or the vagus nerve, which can also be referred to as the brake. And during exhalation, we have an, again, relatively imperceptible decrease in heart rate in terms of beats per minute. So this is very important in terms of understanding how we can regulate our breathing in terms of regulating our heart rate, but also our autonomic nervous system, which is part of the components that are involved in the stress response particularly. So a lot of the information I'm going to give you in this very short video comes from a very interesting and entertaining book, a very readable book by Pádraic Dunne called The Breathing Cure, which I would highly recommend. And step one in terms of the breathing cure in general, but also in terms of this video and what we're recommending you to do in terms of breathing for health is to breathe through the nose. So again, not through the mouth, but through the nose predominantly. So whether you're sleeping, you try and breathe through your nose. During the day, you breathe through your nose. And when you engage the exercises in this short video, likewise, you breathe through the nose. So I want you to remember this very short acronym, which is LSD. So breathe light, breathe slow, and breathe deep. And again, this is from Pádraic Dunne's work and the book I referenced in the previous slide. When we breathe light, so again, one of the ways to determine whether you're breathing light or not is to place your finger underneath your nose and to try and breathe in such a way that your finger cannot detect the air passing over the skin and into your nostrils. And when you breathe, or we breathe light, this helps oxygen delivery in the system. When we breathe slow, likewise, so again, now we're increasing the cadence of our breath, for example. So we might, if we were breathing shallowly, we might be breathing in, for example, 2 or 3 seconds. We need to extend that period of time. And when we do that, we increase our heart rate variability, which is an important marker. Again, it's linked to the respiratory sinus arrhythmia from the previous slides. It's a very good objective way to measure stress as well as many other issues and many other health related markers in the body. But in terms of breathing, if we breathe slow, we can improve our heart rate variability, which is very important for health and again linked to the stress response. Likewise then, when we breathe deeply and we use our diaphragm, and when we use the diaphragm, we use the lower ribs and the abdomen in particular. And if we can combine the LSD, so light, slow, and deep, then what we get is healthy breathing. And if we can do this in a certain cadence, then we reach optimal type of breathing response, which helps regulate the respiratory sinus arrhythmia, but also regulates heart rate, regulates our breathing response and the autonomic nervous system. And as I'll show you in the next slide, can be very useful in manipulating the autonomic system, especially when we feel stressed or burnt out or suffering from anxiety or indeed insomnia. So one of the perfect cadence measures then that we can engage in terms of this type of breathing, where we breathe light, slowly, and deeply, is by engaging in 6 cycles per minute, in terms of 6 cycles of breathing per minute. So that involves 5 seconds inhalation, breathing light, slow, deep, and then immediately going into 5 seconds of an exhalation, again, slow, deep, light, and also in a smooth rhythm where we're not forcing the breath. Now, when we breathe like this, you might feel a little bit of oxygen hunger, and that's normal in this. And when we feel oxygen hunger, we're just slowing things down a little bit, and we're actually maximizing oxygen delivery and oxygen uptake when we breathe like this. And as I said, that has a knock-on effect on our cardiovascular response, but also on our autonomic nervous system. And we would recommend that you breathe like this all the time, obviously, but especially when you remember to do so. So you can get your phone and remind yourself to practice this kind of breathing numerous times a day. You can practice it when you're sitting in a car at the traffic lights, when you're waiting for a kettle to boil, when you're waiting for a bus or a train or a plane or whatever it might be. Practice this type of breathing. Make it become second nature. Make it smooth. Make it light, slow, and deep. 5 seconds in, 5 seconds out. Now, if you are suffering from anxiety or stress or insomnia and you wake up between the hours of 2 and 4 a.m., for example, and you can't get back to sleep, this technique will help you get back to sleep. It will also help regulate a racing mind, especially if you've had a very short, sharp shock, for example, in the workplace or at home or whatever that might be. This will help you regulate the autonomic nervous system by first regulating your breathing process, then your respiratory sinus arrhythmia, and it will help then ultimately with racing thoughts in your mind, for example. Again, I'm going to remind you, breathe through your nose, not through your mouth. And when you breathe, remember, LSD, light, slow, and deep. Now remember, when we exhale, we place an emphasis on the parasympathetic nervous system, which is comprised of the ventral and dorsal vagus nerve, which forms the brake system. So this is the brake of the autonomic nervous system. It slows everything down. It's also part of our rest and digest system. So this is just a reminder of the image in one of the previous slides. And remember, when we exhale, the beats per minute in terms of the heart rate decreases. We don't perceive that, so to speak, but it does happen. And when we exhale, we emphasize the brake and not the accelerator. And when we're anxious, the accelerator is usually in control in the form of the sympathetic nervous system. Now, one way to test whether this type of breathing is working or not, and whether we're actually increasing the parasympathetic response or the brake, is to notice an increased production of saliva in the mouth, or a warming of hands and feet. So this is a handy tip. It doesn't always happen, but you know that you're activating this part of the autonomic nervous system when you experience more saliva emerging into your mouth, and also, as I said, if your hands and feet start to get a little bit warmer. So what is the cadence in terms of what's the magic number here? So we've said that for general breathing, it's recommended that you have 6 cycles per minute. So you have 5 in, 5 out, but you're doing it low, or you're doing it lightly, you're doing it slowly, and you're breathing deeply. For the case of anxiety, stress, racing thoughts, insomnia, burnout, things like that, we want to place more of an emphasis on the brake, because we just need to slow down the system. We don't want to breathe like this all the time, but when we're in the heat of the moment, in the heat of battle, such as anxiety or stress, we place more of an emphasis on the parasympathetic response and the exhalation. So what do we do here? We breathe in for 5 seconds as normal. We breathe out for 5 seconds as normal. We try our best to do it, again, light, slow, and deep, LSD. But when we exhale, you can hold your nose and you can hold your breath subsequently for 5 seconds. And then when that 5 seconds is up, then you inhale for 5, exhale for 5, hold your nose and your mouth closed for 5 seconds, and then you repeat. And maybe do that for maybe 3 or 4 cycles, and then breathe normally for maybe 30 seconds, and then re-engage it again. So you don't want to breathe like this all the time, but it's very, very helpful, as I said, for anxiety, stress, insomnia, or a racing mind. So let's practice this for a couple of minutes so you can get an idea of what this looks like. You can obviously count yourself in your own head, and you can do it anywhere you like, in the workplace, at home, wherever you are, out for a walk. You can also use a number of free apps. There are a number of wearable devices that have these components on them. For example, the Apple Watch, the Fitbit, most Fitbit devices have what's called the Relax app, which is in effect a breathing device that helps you practice breathing. What I'm going to use is a website called exhaler.com, which is just a handy way of seeing and setting the cadence so you can practice with a machine in front of you, you can see a screen, but you don't need a device, you don't need an app, you don't need a screen to do this. But just to show you exactly what this type of breathing is like, I think it's handy for us to use a screen to help us practice this kind of breathing. So, as the slide says, let's practice. So let's begin. So we will follow the words on the screen, beginning now. And remember, just follow the directions on the screen. And remember LSD, light, slow, deep, gentle breathing. After some time, you will get better and better at this. Try and make it as smooth as possible, a transition from inhalation to exhalation. And now I'm going to increase the holding the breath after exhalation to 5 seconds. And you can see it's holding for 5. So maybe we'll begin the cycle now. So gently inhale for 5. Exhaling gently for 5. And then holding for 5. And remember, you can hold your nose here if you like. So let's allow this cycle to move for a number of different cycles to get a feel and a sense of what it's like. Remember, you might feel a slight level of oxygen hunger. That's okay. If it gets too uncomfortable, then you can revert back to normal breathing. But after a few cycles of this type of breathing, revert back to the normal breathing, and you can reset this back to 0 again, where it goes back to the gentle 5 in, 5 out. So that's a very short example of what we mean by these very simple exercises. Again, the general breathing for health, 5 in, 5 out, and then the 5-5-5 type of breathing for stress, anxiety, insomnia, and racing minds. So thank you for watching this very short video, and as always, for more information, please visit our website. Thank you.